Aging Matters on BCTV is supported by the Berks County Area Agency on Aging.
Hello and welcome to Aging Matters. This is a program that is provided by and sponsored by the Berks County Area Agency on Aging. My name is Ann Barlet. I'm the Public Advocacy and Outreach Manager for the agency. Tonight's show actually is part one of a two-part series that we're going to be talking about involving some medication management, and our second part being on opioids. My guest this evening is Marcia Goodman-Hinnershitz, and she's the Director of Planning and Resource Development for the Council on Chemical Abuse. Thank you, Marcia, for being here this evening, and I've got you roped into December's show too.
Right. Well, it's a very complex topic, so we really need
the time. Yes.
Exactly.
Well, we're kind of breaking it down. So our part one tonight will be pretty much just discussing medication management, safety of that, disposal, what we're talking about with medication management. Let's kind of get out the basics.
Right.
And our second part, which will be our December show, will be focused on more discussion further about specifics with opioids and how older adults are either being infected, involved. So that'll be our part two in December. So without further ado, let's begin. Now I start out by saying the program is on safe medication management. So maybe we need to define that right away as what do we mean, what do you mean when offering information to us about what is safe medication management? I get it, I take it. There you go.
Well, I think that's a good point to start with. So the doctor prescribes you medications. You either have them delivered to your home, or you go to the pharmacy and pick them up. Mm-hmm. You have a place that you've designated in your home where you're going to store them, mm-hmm. and you may not always keep track of them. Mm-hmm. So here you have a lot of really complex chemicals in your home that have all been prescribed for a specific purpose, and you need to have a plan on how you're going to manage this. It's not just as a matter of picking up the prescription and then saying, okay, I'm taking it once or twice a day. How much do you understand about the prescriptions, and how do you make sure that you're using them according to how they've been prescribed, how you're going to be reacting to the side effects, if any, and then at a time when you may have unused medications, what are you going to do to dispose of them safely? Mm-hmm. So there's a lot of different layers. We just keep them
stored in a closet somewhere.
Well, it's really interesting because, I'm probably as guilty as anyone of not following what I learned were the rules. Okay, so in looking at this, and just to give you a little background about how the Council on Chemical Abuse got involved, we've always been doing programming for the aging, but with the onset of the opioid epidemic and the fact that we found that a lot of opioid painkillers like Percocet, Vicodin, and such were being misused, they said, okay, what can we do to prevent this? And so we started to delve into what do you need to know as far as good medication management practices. And there's a lot of good resources available. So we reviewed those, looked at what the best practices are, looked at what was being done by the Department of Health, and pulled together a plan working with Berks Encore, Berks Area Agency on the Aging.
It's a mouthful.
Yeah. And, actually, a great collaboration that has made, we have now a program in place that we'll discuss tonight.
Mm-hmm. So and we're focused, our show is on the older adult, and that can, that's a wide range. A lot of our programs are for folks 60 and older. So, let's say 60 to 100 plus. Mm-hmm. And so, why you think after that many years we have a better focus or understanding of safety, but not necessarily, and is there really a concern for the older adult in that realm of medication management and safety of medications?
Right. Well, if you look, there's a difference between the types of medications that are prescribed to younger people, which a lot of times are more for short-term, acute types of conditions, like your antibiotics. We may have received a opioid painkiller for dental surgery, but there aren't large quantities. As you become older, there are different reasons why you might need to have prescription medications. So the number of medications that you have to be responsible for increase, and also the fact that it's now become chronic. It's like you're taking them every day for lengths of time, okay? And then you maybe switched medications. So what we're looking at is, over the age of 65, the average number of medicines is 5 prescriptions.
Oh, okay.
Okay.
All right.
So if you look at that alone,
Well, and I'm thinking even further with that, in that also as folks age and have the chronic conditions, more than one,
right,
they may also have more than one physician
right,
who is prescribing medications. So it's also looking at all of the different components all being able to be safely managed. So all of the different prescriptions that all of the physicians prescribe. So it tends to be also that an older adult has more physicians because of the chronic conditions, and so more medicines then.
And actually, and it will be something that we're going to discuss tonight, is Pennsylvania has a system that helps physicians and patients with that, a prescription drug monitoring program, where doctors are responsible for recording all the medications that are prescribed. Okay, they're supposed to be checking that directory to be able to see under that person's name what might have been prescribed by them by another physician, so that there's a good way. You're not just depending on the patient saying, well, yes, maybe this doctor prescribed this or that. That also should be in the patient's medical records.
Okay.
And then there's best practices that physicians are advised to follow, especially around the opioid drugs. So
That's
it's
wonderful.
become, and it took Pennsylvania a while to get this up and running.
always
It's the last couple years.
We're a little slow at a lot of things.
And it's interesting. If you really want to get into the data, you can actually track it over the last several years, what the changes have been in prescribing practices. But that's probably for another whole show. It's just really interesting when you're seeing that it has impacted on medical practices.
Well, I think one of the things that I thought of, as you said, we either get our meds sent to us or we pick them up. And one of the things that I always am concerned about when we go and pick them up, that might be one medicine that really isn't that ongoing mail order or new one or something like that, or that's where we regularly deal. But even the safety part starts even right then, doesn't it?
Well, when you think about it, okay, first of all, who's picking it up? Okay, is it going to get safely from your home or from the pharmacy to your home? What happens when you get into your front door? Do you store them correctly? And this is a little interesting piece that I hadn't thought about. Where do you think most people keep their medications?
Either kitchen. I'm going to say kitchen.
Okay. And we have
because we always take them at the same time with breakfast.
Okay, that's one good reason. But we have something in our bathrooms called medicine cabinets.
Yes.
Okay, the problem is our bathrooms are very humid places, and so that's not good for the medications. It helps to basically disintegrate them, so that what you said about the kitchen might be a better place.
But
to
it
keep
also,
them.
I think, is similar in that you have the heat of the kitchen, you've got the cool if it's, you have some temperature flux as well.
So you have to be aware, and then you have to look at who's in your home as far as where you're storing them.
Okay.
So if you have grandchildren, okay, you have to be able to store them in a place that's in a safe area where they can't be disturbed. You really need to keep track of what your medications are, just so that you know, has anyone possibly come into your home that's taken some of the medications?
Well, I think that goes to a couple of things. Even when I leave that pharmacy, even before I leave, which I don't think people do, is I need to make sure that I got the right medicine.
Well, that's a good point, Ann.
You know, don't you think? I mean, we don't. We tend to just go, we're waiting in a line, we picked it up, and we're on our merry way, assuming that we got the right thing. And sometimes, it may not be, or we need to double check because it can be confusing if they, I'm used to getting the small yellow pill, and we'll get home and I'm opening it up and I see a larger pink one. Oh, maybe that isn't mine. Do I know what I'm taking? I'm looking on the bottle. Oh, it doesn't have my name on it. Or it's a different name than I'm used to. So it might even start by looking to make sure that the medicine I was prescribed
that's a good point.
Is my prescribed medicine before I go home.
You need to understand is once you pick that up and pay for it, you can't return it. Then it's your property.
Okay.
However, and this has happened to me, is especially when you look at copays and everything that goes in with them, If you do not pay for that and you look at it and you say, okay, maybe I need to talk with my doctor about this, then they will take it back.
Okay.
But the minute you pay for it, you no longer can go back. So, like you said,
Okay.
when you get home and all of a sudden you discover it's the wrong medication, then you're going to have more of an issue.
Okay. So I think in terms of the steps, kind of looking at what we should look at in managing the meds, we talked about when you get home and the storage for the deterioration of the meds and the safety in terms of if you have grandchildren or in areas that aren't, you should be keeping them safe, we'll call it. What about knowing your medicines? There's so often people in groups, if we've asked people on forms that we may complete for a class or something, what medications, it's hard for some of them to even know what they take because they know maybe why they take it. Well, that's for my high blood pressure. That's my water pill. But how often do you think we know what it was, the actual medication that was prescribed?
Well,
and then how am I really supposed to take it when I take it everything at breakfast?
Okay, what's really interesting now the Council on Chemical Abuse provides a really simple guidebook for people to record. First of all, you should be writing down the name of your medication, the dosage that you need to take, when the prescription is going to expire, and all that information. And what you need, especially if it's a new medication, we have a place where you can write down the side effects so that you have everything written down. So if I'm starting to feel a little dizzy or whatever it might be, you write that down. You have your doctor's name and phone number in that guide so that if there's anything that comes up, you call them right away. So it's a way, and then if you change your medications, what you do, you don't want to eliminate those pages because you want to have a history of what you've taken.
Smart.
Now, of course, the doctors are keeping that on file in your medical records. They know all of that. But when they ask you what medications you're on, when you go to a doctor's appointment, they want to make sure that what they know they've prescribed you, you also remember this is what you... Now, for the technically advanced folks, and some of us are all different places with that, there are a lot of excellent applications for your mobile devices. Okay, and the one that I was most impressed by, only thing you need to do is under the App Store, look under medication management. Okay, they have several of the apps will actually give you a place to then type in what your medications are, and then you click on that, and they have a short video about the medication.
Oh, wow.
So rather than trying to read through all that fine print,
yes,
that is absolutely difficult. You have all the basic information about the medication.
That's neat.
Now, what I would say to anyone who doesn't feel that technically comfortable, right, is you have your children or grandchildren. I would think that would be a great thing to give to a grandparent is, even a device so that they could be having that app. And you could ask them to load it for you so they would have the information.
Okay. All right.
So it's something that's real practical.
Good. Well, I think another thing, as what I was thinking of with the device that you were, is a lot of folks could use that to set some kind of alarm or something.
Oh, definitely.
To remind them when to take it because you try to associate something else sometimes with it. Like I keep saying breakfast, but I know a lot of folks take, morning and then take night kind of thing. So they associate it with something which may or may not be the right way to take that medication. So you do want to ask your doctor, is this okay to take this way at this time? But a way to remember it, I would think, would be if you could use your phone and set some kind of alarm. The bell goes off at oh yes, it's my medication time.
Yeah, and I think what you need to do is set a standard that once I get prescriptions filled, I need to record the information, or however I choose to do it. Whether I'm more comfortable handwriting it, whether I'd like to put it in an electronic device. Keep it updated. keep referring to it. The alarms are actually on some of those apps.
Oh, okay. All
Okay,
right. Uh-huh.
so there's a lot of different variations, and just make sure you do it on a regular basis. It's just like you brush your teeth, You need to
Yep.
be able to make
Maintain
sure.
that, yeah,
Yeah.
because then you're ending up with not even sure to be able to take to a new physician, for example, to be able to put down what it is that you're taking if you've not kept it up to date.
Yeah, because I always say to folks, be
Yeah.
mindful of anything you put in your mouth. As far as if it's medications, be mindful of your meds.
So let's just take a second to talk about that because we've been talking prescription medications,
Right.
but that's not the only thing that we take,
Exactly.
right?
Oh, sure, we get over the counter, and you need to read them in the same way and look at what side effects there might be. Some of them are just a step away from some of the prescription drugs. Okay, so and it's always the mixture of them that you just don't know what will be causing what might make you drowsy,
Right.
what might make you have an upset stomach.
Well, and I think sometimes we fail to tell the physician or other folks, including those meds that we're taking, the over-the-counter, the supplements, those
Right.
kinds of things are all, I think as you started the show, they're a medication that's supposed to do something and cause a side effect, hopefully a wanted side
Right.
effect, but it is a chemical that is
Right.
reacting. Okay. So we talked about, making sure that we checked it, we were storing it, we're safe about where we're putting it, we've examined the good ways to make that list, keep it up to date as to what the meds are, some apps to manage. What about other ways to keep our meds, I guess, is what I'm thinking, safe storage of that. Is there a particular way to do that?
Well, I think what's important, first of all, you have to make sure they're accessible to you and easily accessible. Can you handle the bottles to open them? Making sure you keep them in the same place, in the same area where they're out of reach of pets, young children. The kitchen's probably the best place to keep them. And then to be able to look at, if you stop taking the medication, don't just let it sit there in the cupboard. Okay, be able to say, okay.
Just move it around a little bit is what we do.
And I say this is part of Berks County. People don't want to throw things
Exactly.
out, especially things that cost them money.
Exactly, we paid for it.
We
or,
paid for-
or Marcia, I might need it sometime. It might come in handy when I have that again in about 5 years.
Or you might have a friend or a family member
okay.
that has something that's similar and maybe,
yeah.
you can take, and that's absolutely the worst
Right,
thing.
and we're certainly not encouraging that. That
No.
is medicine prescribed for you, specific to you, your uniqueness, and your conditions, et
Right.
cetera. That sharing is not suggested, even
So
if
I
you're the
think-
same family and the same condition.
I think it's just really important to be able to have a disposal plan for your medications.
So let's talk about that. How do I? I mean, we used to flush them down the toilet. Then that's not necessarily right. But I still have the containers. They've got my name on them. I'm very safety conscious. So what is the best way to dispose of the meds?
Okay, there is a simple way of doing it in that every police department in Berks County, due to the work of our district attorney's office, has medication disposal boxes. And they're the size of mailboxes, so they're large.
Okay,
Okay, and you can...
And in every police
Department. Yeah,
Okay.
okay. So in Reading, it's the City Hall right outside the desk sergeant.
Okay.
Okay. So you have a place that if you can't get them, you can at least have them regularly disposed of. So it's almost like I would do it every time I'm done taking a medication, arrange for it to be taken to the drop box.
And so what do I have to do in preparation to do that? Because again, I'm concerned.
Yeah. What's important is to get a flare and to be able to black out your names, all the information. Those labels are hard to get off.
Yeah.
So you can just scratch off
Okay.
everything.
Okay.
Now, what happens when they're put in the drop box is on a regular basis, a detective from the district attorney's office comes and empties that box, takes them to an area where then they're disposed of safely, environmentally safely. Flushing them down the toilet just puts it into our water system, and that's not environmentally
right.
sound.
So do I have to, there was also a question that was raised to me, do I keep the medication name on that bottle?
You don't need to now.
You don't need to,
No.
okay. And do I need to keep it in that original pill bottle? So then that wouldn't matter either. If
It
I
wouldn't
had,
really
If I
matter.
had realized that I combined a couple of them, I
Yeah.
could combine a couple.
If you
and
combine a couple of them, just
Yeah.
make sure you get rid of them right away, because then you're not going to know what they are.
Exactly.
Yeah.
Exactly. But if I did it to save, instead of carrying 4 bottles with me,
Yeah.
and I did it, I
Yeah,
could do
you
that.
could do
That's,
that, yeah.
Okay.
Yeah,
all
they're
right.
not going to be looking and sorting them out for first types of medications. They're just going to be disposing of them.
Okay, good to know. So I think you also wanted to talk about the drop boxes, so they look like the mailboxes in all the police departments in the county. What else do you have? I see something sitting there, Marcia.
Yeah, I don't know what camera would be good to hold this up to. Okay, these are something, and actually it's a partnership between your office and the Council on Chemical Abuse and SOS Berks, which is our opioid coalition. These are called Deterra medication disposal bags. They are for people who cannot get out to dispose of their medications.
Okay.
And I don't want to open this up because that will, then I would not be able to reuse it. What it contains is a charcoal compound. Okay, and what you need to do is put your medications, not the bottle, but just the
actual
loose
pill. Okay.
medications.
Okay.
You add warm to hot water here, about a half a cup, and there's a chemical reaction that occurs that the medication actually dissolves in this bag.
Oh, nice.
Okay, and then you leave it open for about a minute. Then you can seal it up and put it in your trash. Now, even though this looks like a plastic product, it's actually biodegradable.
Oh,
so when it goes in the landfill, it's going to dissolve. So there's not a concern about that. About 25 to 30 pills can be put in one of these medication disposal bags.
Okay.
Okay.
And it's mostly for pill type of.
Yeah,
Okay.
yeah,
Capsule. Okay.
Capsules, okay, yeah.
Okay.
Just more pills.
How do I get that?
Okay, just call the Council on Chemical Abuse at 610-376-8669. Okay, or you can go on our website at cocaberks.org. And there's information. And then we actually have a video to show you how to use it.
Oh, really? Great.
Yeah.
And then will you mail that out, or do I
Yeah,
have
we
to
can
pick
do that.
up?
Yeah,
Okay.
we'll make arrangements so that you
Okay.
can get it. We did distribute those to people who were homebound, that had friends that came to the Senior Expo to get them out.
Okay,
We're working
okay.
with Tower Health at Home, all the different home health care agencies to get them out there.
Wonderful. That's wonderful. So we have if we can all get out, we can use the drop boxes in the police departments, or we have this wonderful disposal bag. That sounds great, and it's a nice amount that you can get in there to just properly dispose of your medications. And was there anything else? The prescription drug monitoring program? Anything particular?
Well, I think it's important to know, and people may be reacting to the fact that their doctor might have done certain prescriptions over the time, but there is a lot more mindfulness from the medical community about the number of opioid drugs that are being prescribed, just because we know that they have a tendency to become abused. There's health issues related to them. Okay, people can develop a substance use disorder because they are highly addictive. Okay, so that a doctor who may have prescribed opioids in the past for pain management, and that's what we're really going to be talking about in our next show, you may see your doctor changing his or her prescribing practices just because there's more stringent guidelines that they're being asked to follow.
Okay. Well, in the 1 minute that we have left, Marcia, it was a fast show, a lot of information. What would you like to make sure that the viewers know about or want to emphasize again?
Well, I think that just like with our smoke detectors, we know that we just had the change of time. We were told to check our smoke detectors. I would just like to ask our audience, make sure you have a plan for disposing of your medication. If you don't do it before New Year's, make it your New Year's resolution. Okay. But make sure I have a plan. Call the Council on Chemical Abuse again at 610-376-8669. We'll help you with that. We work with the Area Agency on Aging to be able to make these activities happen. We'll be going after the senior centers. We just want to help you to make sure you have a plan, that things don't sit, and that you also make a commitment to manage your medication safely.
Great. That's wonderful. Well, thank you. That's about all the time we have for tonight's show. Please make sure you tune in December so that you can catch our Aging Matters show. On the second part series, we'll be focusing a little bit more on specifically the opioids and how that is affecting the older adult. So thanks for tuning in to Aging Matters.
Aging Matters on BCTV is supported by the Berks County Area Agency on Aging.